Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. We're talking about hands, which when injured can affect your everyday routine. We recently spoke with a hand therapist about proper treatment. What is a hand therapist?
A hand therapist could either be an OT or a PT. It's someone who specializes in treating hand and upper extremity injuries. Like anything else, if you're seeing someone who treats the same sort of problems all the time, they're going to have a lot more experience with treating your problem. So they will be able to zero in on your problem, try to get an answer for you on how to improve your situation much quicker than somebody who's just stumbling along.
How does a patient get referred to the hand clinic?
It's really important to get in and treat them very quickly. We oftentimes will see them through the hand clinic. The doctors see them first, and then they refer them directly to us on the same day that the doctors see them. We often will make a splint for the person to make sure that whatever structure that they had fixed is going to be protected, or if they had a fracture, that the fracture is protected. And then we also start with range of motion and teaching the person what they need to do to get better right away. Thus, they can have a better outcome.
What are some of the types of hand injuries you see?
Well, right now we see a lot of people that have injuries because of ball sports, outside playing basketball, soccer injuries, and also we see people who have baseball injuries. One of the biggest ones that we see are people who have mallet fingers. What happens with a mallet finger is the person gets hit by the ball, it bends their finger, and then they can't extend the tip of their finger up. And people don't really think of that as being too much of a problem at first, but when they notice that they can't bring their finger up, for a little bit, then they go back, they see the doctor, they might go to the emergency room, they get put into a splint, and then they get referred to our clinic. So then they go through our clinic, they see the doctor, and what we find mostly is that people who went through the emergency room oftentimes are splinting, but they're taking the splint off in between. And the problem with that is that it's a tendon or a bone that has been, the tendon has been ruptured off of the bone, or a piece of the bone has come off with the tendon. And if you don't keep it 100% of the time straight, it's not going to heal, because every time they bend their finger, they're causing the problem to get worse. So we do a lot of education, especially with these types of patients. And those patients are really well taken care of in terms of using a splint for a period of about 6 weeks. And if they do it the right way, they usually have a complete resolution of their problem.
What are some common overuse injuries in the hand?
At this time of the year, we see a lot of people with tendinitis type problems, some arthritis type problems. People get outside, they're doing more, they're doing their gardening, and they use their hands a lot. So we see a lot of people with that problem.
What are some treatments a hand therapist would offer?
For somebody with tendinitis, we would teach them, well, first we would make a splint. Or even with arthritis, we would make a splint to give a little bit of protection, decrease movement so that the person isn't aggravating their painful condition. And then as the pain starts to go down, teach them what they can do in terms of joint protection, how they can change their daily activities in order not to aggravate the condition.
Where in the recovery process is therapy? Is it first or is it last?
It can be both. We get a referral from the physician, and then we treat the patient. We'll treat the patient. If we find that the person is not improving, or they tend to plateau, then we will send them on back to the doctor, for other options in terms of medical treatment for this problem.
What do you suggest for patients with chronic pain?
Well, first of all, I would have them go and see a hand surgeon to really be adequately diagnosed what their real problem is, because it may not be what they think it is. So many people think they have carpal tunnel because they have pain in their hands, but they don't have carpal tunnel at all. They may have a tendinitis, and you would treat these two totally different ways. So it's good to get a really good diagnosis.